12 months have passed since the first COVID-19 cases emerged in Germany. Meanwhile, the virus has claimed more than 56,000 lives here. More than 2 million have been infected, and the number keeps climbing. Over the past year, we've had to adjust our day-to-day lives to a new reality that we could hardly have imagined before. It's been a whole year since the prospect of a family holiday has become a remote possibility, even impossible. A year of keeping our distance from friends, colleagues, even our own families. And every day we witness the consequences of the pandemic. Restaurants shuttered, inner cities deserted. Public life has come to a standstill. Welcome to our COVID-19 special. I'm Monica Jones from Berlin. Good to have you with us. 5,608. That's how many new coronavirus cases were registered in Germany over the past 24 hours. No big deal. We've had worse. Now imagine hearing a German saying that a year ago. Unthinkable. But 12 months of this pandemic have changed us. Here's how it started.
Germany first came across COVID-19 here, at the offices of this automotive supplier in Bavaria. It's where a 33-year-old employee caught the novel virus from a co-worker who had traveled to Germany from China. He became patient number 1. German officials were quick to assure the public the country was taking the virus seriously, but that there was also no cause for alarm. Health Minister Jens Spahn told the public there's no need for exaggerated concern. The World Health Organization echoed this, with calls for simple measures like more hand washing.
Self-protection is still the best possible way we can go about this.
But infections spread to every region in Germany. Contact tracing became impossible. Germany's hold on the virus gave way to the free spread of COVID-19. Then, just 6 weeks after the first case was discovered, Germany announced the closing of schools. By the end of March, a nationwide lockdown meant the workplace and the school day had to compete for attention in homes across the country. The bulk of people in Germany seemed to take the restrictions in stride and agree with them. With the budding spring, Germany slowly started opening up again. But by the start of May, nearly 7,000 people in Germany had died. Meanwhile, elsewhere in Europe, the numbers ranged from more than 24,000 to over 28,000 deaths. In comparison with many European neighbors, Germany appeared to have weathered the height of the crisis fairly well. Many people enjoyed the warm summer months. But then fall arrived, and cases began to rise again. By November, a so-called lockdown light was in place, despite both calls for stricter measures, as well as protests against them. But the mini lockdown didn't work. Cases rose at alarming rates, with more and more patients needing intensive care. By the Christmas holidays, restrictions had been tightened again, and after the New Year, schools and shops remained shut. The latest extension of Germany's lockdown will continue through February 14th.
And for more, I'm joined by Merle Böhmer. She's an infectious disease expert at the Bavarian Health and Food Safety Authority, and she's been involved in analyzing the new coronavirus right from the start when it first emerged here in Germany. Good to have you with us. Please tell me, when did you know what we were dealing with?
It was the very beginning of last year's January when a colleague of mine sent me the link to the WHO report on pneumonia cases of unknown origin in Wuhan, China. And he asked me, Merle, what do you think about these cases? Are we going to expect something really big here, a new SARS maybe? And I said, well, no, I don't think so. Definitely not. Oh, how wrong I was.
It took a while for the rest of the population and authorities to revise the views. I mean, I remember that I was flying from Munich airport in late March, so much later than those first cases emerged, still before the lockdown though, and the security team there was tested positive, and we were all there without masks. I mean, dealing with that situation a year ago, it was learning by doing, right?
Well, every outbreak investigation is kind of learning by doing. Why is that so? Because every outbreak is different. You have to adapt your methods. You have to adapt the measures you implement to stop the outbreak. And yes, it's always a unique situation, but of course last year that was very special, very unique, and to be honest also very exhausting and challenging.
And still, it still is. It's ongoing, and even a year into the pandemic now, we're now in the second year already. We still find it hard to say where a person got infected, and that's significant. Why is it so difficult?
Well, as you said, with ongoing virus transmission, and we have observed really intense virus transmission and circulation for several months now, it's really hard to trace back infection chains. Why is that so? Because on the one hand, it takes some time and effort to reconstruct transmission chains, well, the public health authorities have been working at their limits for some time now, and their priority is to prevent forward transmission, meaning that to prevent further spread of COVID-19. And also many cases do not know where they got the virus from. And there are also some cases who do not want to say where they got it from.
Yeah, and all of that makes it more difficult. And on top of that, of course, now we have the variants that are said to be even more infectious than the original virus. So it still feels a little bit like learning by doing. How has the pandemic changed your life?
Well, in many ways, of course. It was a very challenging year for me professionally, and I have two kids. It was also, with regards to my private life, very challenging with homeschooling, etc. But also, what I want to say, I have never been so thankful for all these brilliant work scientists do all over the world to develop a vaccine that's effective against a novel virus within 12 months or even less than 12 months. Is just brilliant. And what I want to say is that if you get the chance to get your COVID shots, when it's your turn to get the vaccination, do it for your own protection and also the protection of your fellow human beings.
Right, that's certainly a new chapter in the pandemic, the vaccination. Mel Böhmer from the Bavarian Health and Food Safety Authority. Thank you so much for your time.
Thank you, Monica.
And it's time now for your questions. Over to our science correspondent, Derek Williams.
When will we get back the normal life as we know and lived it until the end of 2019?
I decided to answer this on air because I'm asked the question so often and by pretty much everyone. And you know what? I can't give you an answer. No one can. I can only guess. And you know what else? No one can see the future. So what all the experts out there predict is just guessing too, though some guesses are, of course, more informed than others. So that said, here's my best guess. It's based on two factors that should be clear to all of us by now. The first is that the only way to return to some kind of normal is through vaccination. The second is that means worldwide vaccination. Until we're all protected, we all remain in danger. The current flock of variants has revealed how quickly this pathogen can cross borders, and the longer we leave it in wide circulation, even if it's in other countries, the higher the chance it'll mutate into a variant that can do an end run around vaccines. So vaccination programs have to be fast and they have to be global. I see it as a numbers game. How much vaccine can we make, how quickly, to reach herd immunity everywhere, which many experts say is around 70% of humanity. That's around 5.5 billion fully vaccinated people. Since many vaccines require 2 doses, let's call it 10 billion doses. For this back of the envelope prediction, I added up what makers of different vaccines currently in use are now claiming they can produce in 2021, which as far as I can tell is around 8 billion doses. So not enough to round the corner globally by the end of this year. Granted, those numbers change constantly, but there's still no question it'll also take time to distribute those billions of doses. So right now, I just can't see a return to something approaching global pre-pandemic norms for at least a year and probably a lot longer. Though in individual nations with high vaccination rates, things will likely grow more relaxed before that, maybe as early as this summer. Best guess.